I'm resuming recording.
Okay, so this meeting is being recorded. If anybody else is recording the meeting, they need to let us know now. Okay. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation can be found on the Office of the Attorney General's webpage. No in-person attendance of members of the public will be permitted. Draft minutes will be posted on the town's website as soon as possible after the meeting.
I'm here.
Hi, Kate. Pursuant to Mass General Law, in an emergency, a public body shall post notice as soon as reasonably possible prior to the meeting. Notice shall be printed in a legible, easily understandable format. It shall contain the date, time, and place of the meeting, and a listing of the topics that the chair reasonably anticipates will be discussed at the meeting. Okay, everybody take a look at the minutes of the last meeting. Sue?
Yep, all set.
Jean?
Yep, all set.
Tammy? Thank you, Jessica. Okay, we're all set. I got a motion to approve the minutes from last meeting.
I'll make a motion to approve the minutes of the last meeting.
Second.
Second.
Sue? Sue, yes. Jean?
Yes.
Gary, yes.
Yes,
Okay.
Sue.
Public comment, 10 minutes. Who's chairperson of the board now? Doug, do you have any comments? Public comments you want to talk about now?
Oh, no. I think we're
There
all
you
good.
go.
Hey, Jessica.
Yeah,
Jessica, in the minutes, you'll have to change Doug for chairman.
okay, thank you for pointing
Right.
that out.
Joe? Anything for public comment? Peter?
I have questions about vaccine logistics in the hopefully near
Why don't we
future.
hold that for the
Sure.
COVID report, okay? If you don't
Okay.
mind.
Yep, that's fine.
Okay, so I'll reserve rest of the time if anybody has any questions at the end. Health Director's report, Ms. Spencer.
Okay, well, we've had a sort of a short 2 weeks with the holiday and everything like that. Very light on activities that had nothing to do with COVID, I'll tell you that.
Hold on, is Kate coming?
Kate is going to try her best to come, but she might not be able to make it. I have
Okay.
her report though.
You do? Okay, I'm sorry. Go ahead.
I do have her report. Let's see. Only one final septic inspection at 130 College Highway, and 3 sets of plans were submitted for septic approval for 2 Noble Steed Crossing, 26 Coes Hill Road, and 187 Vining Hill Road. We had the Hampden County Health Coalition meeting this morning. I attended a private well workshop, and I attended a seminar by CEIT, the COVID-19 Enforcement and Intervention Team, for understanding their playbook. And this playbook is such an interesting resource for towns. It's part of the website, but you can find it on mass.gov, and it's got great things for websites and media and videos. And what they're working on is putting together materials to, I guess, kind of convince people of the safety and efficacy of COVID-19 vaccines when they come out. So that's something that they're working on. So that's what the meeting was mostly about. That's it for things that weren't related to COVID-19.
Okay,
There's been no shortage of phone calls and concerns and questions, and Kate and I have been super busy with the calls. It's funny that until recently, most people who tested positive did not contact us directly. people have been contacting us pretty much every single day when positive cases have come up, which is great that we find out early that they have that they've popped up in town. It's still, the numbers are still really high. The select board's office and Carl Steinhardt took a phone call today from the Executive Office for Health and Human Services, which is where the Department of Public Health is located. And they confirmed today that we are now moving back to being a step 1 community, since we have been in the red for 3 weeks consecutively now. Being in the red would be that we have more than 25 cases per week. And so for right now, for the month of December, Kate has that we have 7 cases. That's just since Tuesday. Right now, we have 41 cases in quarantine and 47 cases in isolation, with 1 in the hospital. In the last 14 days, which is how they put the information up on the state website, we've had 797 people get tested in town, with 58 positive cases.
In 2 weeks?
In 2 weeks. Yep, that's as of yesterday. So they're plugging on. Oh, you know what? Kate made a graph. Hold on. Let me see if I can share my screen. Let's see. You can see, like, so this is from March, and our spike now is way bigger than it was in March. And our positive testing rate is pretty high. I think it's 7.77 is the math that Kate had done on that.
Tammy, can you move it over a little? I can only see as much as
Can you-
November 15.
Can you move our pictures to the other side of the screen? Just click and drag. Does that work for you?
I want to see to my right, because our faces are covering it. Can you?
Hold on the box with our faces and move them us.
Drag.
Oh, we can drag our faces. Oh,
Yeah.
okay, never mind. I dragged the faces. Thanks.
There we go. I can make it a little bit bigger. Let's see.
It's fine.
Is
Yeah.
is
No,
that
that's fine. Thank you.
Now that's it's too, there we go. So I don't have too much information like about basics of the cases because Kate's got all that stuff. But she's been very busy. I'm not sure if, oh no, this happened after our last meeting. So about a day after the last meeting, Kate was contacted by the Contact Tracing Collaborative and informed that all of the cases that had been sent there over, I think, a 3-week span were not contacted. So on that Friday and Saturday, Kate and I had to backtrack and call up all those cases because apparently they're so backlogged that they couldn't even tell us that they weren't working on cases for the town. But nothing that really was, Kate doesn't send any cluster cases to the CTC. These would just be like standalone cases. Anything that's clustered, Kate would keep. But so Kate is trying really hard to not have to send anything to the CTC, but it is very hard for her as one person, I think, when you have 58 cases in.
Well, I've asked her a number of times if she needed any help. Not only at the meetings, but when I see her, and she said no, she didn't need any. So,
yeah. So this month has been the busiest month.
Sure.
Just looking, I mean, just if you look at the numbers, they've been tremendous jump here. Let me.
So what's a stage 1 community mean? What do we have to backtrack? What closes?
So it's really not a lot for our town because a lot of the services that are affected by it we don't have in our town. I'll just kind of go over it. The red, okay, phase 1 community is when we're red category for 3 consecutive weeks of Department of Public Health weekly reports. This goes in effect on Monday. So tomorrow, I don't think I'll need help, Jess, filling these out because it's really not that many businesses. Some of the things that we're not allowed to have in town as a phase one community, which we don't really have, are indoor performance venues, roller skating rinks, trampoline parks, obstacle courses, laser tags, and escape rooms. We don't really have that. But what we do have that will be affected is there are certain businesses that currently their operating capacity is at 50%. It'll have to be reduced to 40%. And these things are gyms and libraries, museums, and arcades. We don't have that. And that's pretty much all that affects our town for that. And I've already talked to the library, and I've got information ready to go for the gyms and our one museum. So outdoor theater and performance venues can only operate at 25% capacity and absolutely no more than 50 people. So we've gone from 100 people to 50 people at an outdoor gathering. But I'm not sure how this affects some of the events that are planned for Christmas.
What's planned?
I know there's a toy drive. If Joe's there, maybe he might know. I'm gonna stop screen sharing. Is he shaking his head? You have less than 50 volunteers.
Yeah, we're fine. Honestly, we have 25 people coming an hour. They're staying in their cars and their masks, and we're doing selfies with Santa. So no one's getting out of a vehicle. Kids are on the passenger side. Santa's got a mask on. We take the picture and email it to them. And there's only...
Yeah, the people in the car, the number doesn't factor. So your volunteers and people who helping, that is what you have to limit under 50. And I don't think you had 50 for volunteers for the last thing you did either. So
we did 187 meals at Thanksgiving. We had probably 30, 35 that came through within an hour and they were gone to deliver meals. Yeah.
So the drive-through concept isn't,
Thank you, Joe.
Those numbers don't count as long as they're stay in their car.
Yeah. Well, I sent you pictures. Everyone was masked and gloved.
Great. Yeah. That was like the best,
yeah. It worked out very well. Mr. Mogman was in charge and it worked out great.
I'm really happy. I'm glad that in the face of everything that's going on, we can still kind of, keep some of these things and these traditions that the town does. And it might look a little different than before, but turkey's turkey, unless it's Southwestern seasoned.
Thank you, Joe, for doing that.
Let's see, what else? That is that for the step one information. Okay. So we'll move on to Peter's topic or question. So there's been a lot of buzz and information going out about the COVID-19 vaccines. So this week, let me get the papers out. Well, I'll backtrack. So the state has sort of adopted and tweaked the CDC's playbook for COVID-19 vaccination. It's pretty much very similar. They put out an interim draft in October and they haven't changed it much. And it's still called the interim draft, which I'm assuming is because they always anticipate things to continue to change. And so in it, and all this is up on mass.gov. So if you were just to even go on mass.gov and Google COVID-19 vaccination plan, it will come up. The general public can take a look at it. I guess the thing that most people are interested in is the phases of dissemination of the vaccine, which even though a lot has been said, it's always up to change. So the first scenario, which is phase one, which is where there's a potentially limited supply of COVID-19 vaccine doses available. And that's what we're assuming is that the state's going to have a limited supply. So those would be phase one. So phase 1A and phase 1B would be these two separate sections. And phase 1A would be for paid and unpaid persons serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious materials and are unable to work from home. And phase B, 1B would be other essential workers and people at risk for severe COVID-19 illness, which includes people 65 years of age. They're targeting most likely healthcare providers, the hospitals, long-term care facilities, skilled nursing facilities, and EMS, and other healthcare providers. I saw that a lot of, they call them the mass community clinics, I think is one of the ones that they talked about.
So in phase one,
Yeah.
when are they gonna let us know, A, how many doses we're gonna get, and B, are we prepared to administer them? Because it's gonna happen soon.
It's not going to happen soon for us,
Because
Board of Health. But that I can bring that to the second part of is this week, this state sent out vaccine program provider agreements to all the towns. And thank you, Mr. Moglen, for signing off on that, because the town's chief executive officer has to sign off on the application. So that puts us eligible to receive the vaccine. It's a lot different than how we would normally do it for emergency dispensing sites, which actually I talked to someone from the Office of Preparedness and Emergency Management. They didn't even know that they were using this method of this application process. I found out today. It's a lengthy application. So actually, Jessica, we're gonna have to work on getting that information from Bay State.
Sorry. Okay.
About the provider information for it, because we're gonna need that to have the doctor's name and everything like that for standing orders.
I can't get anybody to respond to me on that, but all right, we'll work on that next week.
Yeah, that's in order. Yeah, we'll need to do that so we can actually apply.
Okay.
We're not expected to see probably anything on our end till the spring, but I think you're going to start seeing before. Well, I think it might be slightly in conjunction with commercial entities getting it, which is a good thing because they proved that.
so if you're over 65, even if you live in Southwood, we're not gonna get vaccinated till the spring.
The 65 will get vaccinated during the phase in which we're talking about skilled nursing and in hospitals.
That's phase one.
Yeah.
Hey, can I ask a question? You're talking
Sure,
about
thanks.
getting a vaccine, but the thing is the storage.
No, it's not going to be an issue.
We have a -70, -70
That will
Celsius
not,
freezer
that,
if we get Pfizer.
Let her finish.
we wouldn't get Pfizer. Pfizer is the one that's going to go to the hospitals first.
Right, so what are we gonna get? Moderna, probably -20?
Nope.
No, anything that we get is going to become packaged in their own unit, and we other than refrigerating it to keep it safe, we're not going to have to worry about temperature storage.
So how can we, if we only have two choices right now?
We're
that
not
are
going
out
to
there?
get probably more than an igloo cooler sized container. That's probably the largest of size. Like it's going to be about this big. And it's going to be wrapped so that it will stay at the temperature until it's ready to use. It won't be given to us in advance either.
So it'll be on dry ice.
More than likely. They didn't describe it, how it's contained, but multiple people within the state have told us that it's not going to be a crucial issue. I mean, I'm identifying, trying to survey locations that have refrigeration if needed, but it's not going to be the thing we're getting a pallet. We wouldn't have gotten that anyway. Like if you thought of like a flu clinic or something, like 600 doses, it's just a cooler.
And how many doses?
I wouldn't know. We're nowhere near letting us know that information.
So, okay. So then if you don't know how many doses, you don't know how many nurses you need, and that's still up in the air. Is that correct?
If they give us 50 at a time, then one nurse would probably suffice.
So you
We'd have to have everything all set to go. We'd get it and have to admit.
Yep.
That's
people
what
are gonna
this
have to
month I've been
know-
working.
You'll have to know, taking it out of storage and how long it's stable out of storage.
One of the things that I had been working on with the Western Mass, oh my gosh, what is our group called? Sorry,
Coalition?
guys, my brain's not working. With our Region 1, we have several different public health emergency preparedness groups. But over the last couple, like 2-3 years, we've been working with identifying refrigeration and cold storage survey usage. So we've put out a survey quite some time ago to identify and some of the things that were identified areas to work at to use as storage for a region. There is a facility in Chicopee that can hold. They can hold at any temperature, and they provide security and everything for that purpose. But I mean, these are just ideas that we've floated around as a group. Nothing has really come to that point at the moment, though. But I don't think we're going to get a lot that we're talking about pallets. It's every town's probably going to get a cooler size, and that's it.
So my question is, I assume that this vaccine is going to get approval on the 10th. That's the meeting date?
Is it 10th or 14th or something?
Okay, so within the next
Yeah.
2 weeks, those vaccines are going to be rolling out. Is that correct?
They're supposed to be.
So
By
so
far the expert on this topic.
okay. So what's our plan? Or do we have one? About who gets vaccinated in town? I assume police and fire. Do we do the cottages and then Rosewood? I mean, is
that sort of thing, like the nursing and stuff like that, that's going to be determined by the state, not by us.
okay?
Yeah, that part will be determined by the state. EMS will be covered in the first phase, and then when we go to phase okay, wait, where's then you start identifying other critical services after that. And then after that is phase 2, which is large number of vaccine doses and broad usage. And this is when local health departments, community health centers, pediatric providers will be, and other commercial entities will be able to will be getting the amount to administer the doses.
Do you expect that comes to you before the next 2 weeks? And if it does, will you just know if they're shaking
March,
their-
April, maybe? No,
For the
they're
first
not
rollout?
giving us a date, but they're saying springtime.
For the first rollout or for general use?
For the health department to see that, it's probably gonna be closer to spring.
I understand that's for the general use. Is that what you're talking about? It's the population, people under.
For phase 2, the large numbers,
Yeah.
the way they're making us believe it's later winter, early spring,
I understand that, but I'm talking about phase 1 and 1A. We have people. in town
late
that-
December.
Okay, so
I guess the hospital's in late December.
do we have anything to do with that, or that's going to be administered where at the hospitals and?
Yeah, we don't have anything to do with that.
We don't. The state's
No.
going to say you're eligible and you can sign up, or how's that going to work? I mean,
No, they're identifying specific hospitals and specific areas within them, it's not blanketing an entire, hospital. It's they're covering areas that they think are important.
All right. I'm a little confused, which is easy for me to do. So I understand you're going to do healthcare workers first and providers, and then the way I understand it, people in nursing homes. And so that's going to be coming up in the next 2-3 weeks. Is that
I believe
correct?
that's when it's going to start. Yeah.
So that's not going to be administered in town at all. That's going to go to where.
I have no idea if if, uh,
Oh my gosh, what is American Inn called now?
Cottages.
Like, I don't know if the cottages are affected, if that is something they consider, they only have they only have a skilled nursing floor on it. They probably would also look at the cluster numbers and see that our town has not been a cluster for senior numbers in senior living. So, I mean, I
Okay. Then I'm just-
expect we wouldn't be up on their radar.
Okay. All right.
Yeah.
Sue, you have any questions about this?
No, I have a lot of information from Day State, so
You want to share it with us?
basically what Tammy said. I mean, I can
Okay.
share it with you. Want me to read it all to you?
Well, you don't have to. Jane?
You're on
Okay.
mute.
Unmute. Can we unmute her or
Jean, you're on mute.
you're muted?
Oops.
Okay.
No, I'm just, as impatient as everybody else is. And, you got to wait your turn in line.
I know. Okay.
So,
At least there's going to be a line.
Yeah.
No, there might not be a line because the
Yeah.
state purchased, they purchased the ProMed or ProMedic company program that will allow us to
Schedule appointments. So it wouldn't be,
us is in the Board of Health to schedule appointments.
yeah, for local public health. Yeah. It's like an app and you would go on it and it's just like CVS has right now to schedule a flu shot.
Doug,
You're
Yeah.
on mute, Doug.
I was laughing so hard at Gene, I did it to myself. So I think it's great. I mean, I seen some of that. And when we had last spoke about starting to thinking about preparing for this, which I know we're way off in the spring, but are they on the guidance on the vaccine? Are they still talking about a patient observation period after administration?
They
Because that was a
have
big
not
topic
mentioned-
of discussion, right? Because if it was a drive-through thing, drive-through, shot in the arm, keep going, right? But if you got to keep an eye on somebody for 20 or 25 minutes after the shot, that's a different story.
That
You're
is
gonna
a
have to
very
keep
good
going.
question, Doug.
That has not been brought up to us in our talks yet. Yeah. That's
my
a-
guess. if
Here I
was a-
am asking the good questions.
If I was a betting man, the person, that they're going to make you wait somewhere. I mean, they do that with flu vaccines.
That-
They do
yeah.
that with allergy
Well, the flu,
shots.
I mean, you go into CVS, you get the flu and you go
Walk out.
home, right? But I
Right.
mean, like I don't know, I agree, but it's going to be logistically, it's a huge difference to me in planning, an operation of administering X number of vaccines over Y hours if you've got to keep an eye on each
Right.
person for 20 minutes versus,
So my
you sit
guess,
up in Wally Park and you drive through, get your shot and get out of there, right?
my guess is that somebody has statistics on how many people have dropped dead from getting a COVID-19.
Well, I think we're going to have and the good news is for good or for bad. Good for the people that are after March, maybe bad for the people that got it in December. We'll have better information in March.
Yeah.
Hey, Tammy, have they talked about how the booster is going to work? Like when somebody's due for a booster 28 days or 21 days later and
You got to do it twice, yeah.
there's no shots available?
They haven't talked to us about it yet.
No, or do we keep track of it or how that's all going to happen? Okay.
Well, it's gonna help with the
if we decide to utilize this, I think it's called ProMed app.
Something like that.
It'll give reminders to people to come back to it. And
You would think, Doug,
Just one more question on that. So from what I heard too is that if you get the Moderna in round 1, you got to have Moderna for round 2. So you can't get Moderna then Pfizer, right? In shot 1 and 2. It has to be the same vaccine twice, correct?
I
that's
believe
what
so.
I've been told.
You'll have to track that in this scheduling thing, right? To make sure. So I assume
think
we'll
that the
get the
town would
same
probably
thing,
only, yeah, we would probably only get one particular type.
but it's going to be a month later. So it's probably going to be for sure a second delivery. It's not going to sit somewhere for 28 days in town. We don't have any place to keep it. Right. Interesting.
Yeah, no, that I am I am surprised at the lack of like planning guidance that's come down from the state. I still think
This is called an interim draft. Still, it's, this is what we're going off of when people want to know the latest information. We're going off the latest interim draft, and they haven't really thrown down any information on what how we should be tweaking our emergency dispensing site plans, other than telling us that our traditional emergency dispensing site plans are not the correct model because they rely on high throughput, which is something that we've been fighting against for the last 10 months. So that would be why they would be more like smaller managed clinics, like 50 doses, that sort of thing. So but that's not how all of our emergency dispensing site plans are written. And so later this month, I want to get all the players together so we can sort of start talking about the best ways that we could probably come up with smaller clinics. We tried the whole outdoor clinic at Wally Park and it was freezing. The poor pharmacist, I thought they were going to fall off. So I don't know whether or not that's going to be like the appropriate way to do clinic. And also that method is still also up for us using a commercial provider to come and administer clinics for us, for the town. So those are some things that we can also think of, very similar to how the flu clinic model is going. So there'll be lots of different ways and avenues that everybody will come across the vaccine, and I think that's a good thing.
So my fear is that we'll have a vaccine and we won't have a plan to administer it.
I have been looking up and working on this for 9 months now.
Okay. We trust
We
you.
have a plan. The plan needs to be tweaked, and I do not worry about the plan. The plan will come together.
Peter, any questions?
No, you answered all my vaccine questions, but if I do have questions about the cases in town if the vaccine discussion is done.
Tammy?
I think we went through the notes I had, actually. Yeah. I just also would like to say that I'm not a doctor and I don't play one on Zoom meetings. So all of this is given to you with my public health expertise and not medical expertise.
Sue,
All right.
do you have any questions about the vaccine?
I'm all set.
Jane?
No, thank you.
Doug? Joe?
I just want to say that I have complete confidence in a plan that we're going to have put together, and I will commit on behalf of, as a police commissioner, fire commissioner, and selectmen, that we will bring any resource necessary that Tammy needs to get that done. So
Okay, we'll remind you.
you have it, and with Joe as my witness and Jean.
Yeah,
So
and-
I mean, we'll bring whatever we need to bring to help this roll out. And I don't know what the plan is going to be like, and I'm sure Tammy's going to involve us as it comes to maturity, so that we can all be ready to support this 100%.
I think unfortunately there's going to be a percentage of the population that won't take it.
That's I was actually having that conversation with somebody outside of here, and I think that's going to be self-fulfilling, because there's going to be, their employers are going to mandate it, just like they do in the hospitals for the flu shot.
They can't mandate it because it's an emergency use authorization right now. So they can't mandate it.
Okay.
Well,
That's probably a topic for a different day, but
That's what I got from Bay State today.
and I think we're going to be in a better place in March to have a better understanding when you've got a couple 10 million people that have already had it for 90 days. And yeah, so you know what the numbers going on, right? You have a way better feel for it.
Okay, so we've got a
Thank you.
bridge to cross, but at least it's a bridge. At least we have hope that the light at the end of the tunnel.
And it's not a train, right? Exactly.
But once it's FDA approved, it could be mandated.
And how long does that normally take? They wait for more data, Sue? Susan,
I guess
Emily.
so. Yeah, they probably wait for a while
okay,
to see what the side effects are.
all right. Jean, any questions about the vaccine?
No, not
Peter,
at this time.
Nothing about the vaccine, no.
how about the numbers? Go ahead.
So if I recall correctly, last week was a short reporting week and 18 cases were reported. So does that mean 40 cases have been recorded since then, since last Tuesday, I think? Which would obviously be a longer reporting week too, so you could cut down that average a little bit, but
I don't have the final tally for this week, so I couldn't say if that. I just have her actual cases right now.
Her
Okay.
actual isolation and quarantine right now.
okay. But yeah, you said 58 cases in the last 2 weeks.
Yeah, but based off of the state data. So
Oh, okay.
Good.
Wednesday to Wednesdays, 58 cases.
Gotcha. Okay.
But tomorrow, Kate will give me our total number and our pandemic total number.
Okay.
So what's the total number as of tomorrow?
I don't know.
I don't know. Okay.
Okay.
Give me that number tonight.
Okay. We'll find out
All right.
tomorrow.
Just that there's 41 cases in quarantine and 47 cases in isolation.
Okay. And were you given any sort of breakdown and like where those cases are in the town? Like you said, there's no clusters, but
There's no
like,
clusters, but when we look at the map and we pinpoint, Kate was kind of putting, she was putting pins on addresses. It really just looks, the cluster wise, it looks like it's just as clustered as the houses are clustered.
So it's a
Is-
trick or treat truck cluster.
Yeah, it not like they're not clusters themselves, but if you look at them, the red dots, they, they're closer together and neighborhoods are closer together. There really hasn't been, and I know Kate has, and the same thing with the people I've talked to, a lot of people don't know where they honest or not honest, people that are very surprised at that they came positive or they came down with it. I'm sure some people aren't, but it just feels like it's I'm kind of backtracking on the word, but the pandemic is now endemic in our community.
Yeah.
Just throughout.
yeah. So is there any sense that Thanksgiving had anything to do with the sudden, well, not sudden, it was obviously surging a little bit before then, but
It's been
We haven't gotten the
very
Thanksgiving
consistent.
cases yet.
you think that would pop up in next week's numbers, most likely?
Yeah, I would say so. We
Okay.
seemed like we had one day off from numbers, and I think that probably was because there was Thanksgiving was probably a day where people didn't go get tested.
Oh, that's probably, yeah.
And then all of a sudden the next day we were back up to 4 or 5 cases a day. I think one day we might have had somewhere up to 7 or so cases. So it's just really here and within the community.
It is.
I don't think that there's sort of like one group that it's really holding into other than others. It seems it's here. And now a lot of people who I've talked to who are kind of like, well, they didn't know of anybody having it. They didn't know of the seriousness. I've a lot of talk of people that, it's now touched their households or their work or their family. I've certainly the numbers of phone calls of businesses calling, what do I do? I have a positive employee. Those have gone up a lot this week. And I think it's a testament to businesses following the workplace standards and the protocols that we've been able to really keep the contact tracing like really neat, around those cases that pop up. I'm glad people are sticking to that, but it seems it's spreading very easily.
We had 5,800 cases in the state today.
Is it 58 today?
5,800, yeah. Well, it was 64, but they had 600 cases that were delayed from the laboratory, so they put a little caveat on it. Whether it's 58 or 64, it's still a lot.
Yeah,
So
I've
what-
talked to a lot of communities too. There was in the last 2 weeks, there's been a lot of burden on testing centers. I know in Southwick, there was a point where it was a 2-week or 2-day wait just to get a CVS test.
But you could get it.
Yeah, because they were running out of the materials, and that wasn't just unique to Southwick. A lot of the communities were feeling it.
MedExpress was a 2 to 3 hour wait. You sit in your car and they would call you and then you go in and get
Yeah.
tested. So they weren't that bad. I think some of the drive-throughs, Eastfield Mall was a lot longer.
I heard that. Yeah.
Yeah, I live around the corner from that.
Well, so MedExpress was doing it well. Bay State, they make you register, I think, Sue. Is that what you have to do? And then it was kind of convoluted.
Yeah, I don't think Bay State's that easy.
No, they were convoluted. MedExpress was really good. You went there, sat in the parking lot, called them, and they put you in a line in the car, and then they came and they got you. So it was pretty nondescript, at least from them. Okay. Anything else? Peter, Jessica, you have anything?
Well, I have a
No,
question.
I'm good. Thank you.
I have a question. What did the officer find when he went to the church? Last
I
week?
didn't get a report back. They haven't been working, so I hadn't received a report back yet.
Does anybody know how the recent Supreme Court decision
I was
Your
just
case-
about to ask that. Thank you.
is going to affect us? I spoke to the chief the other day and he seemed to intimate that they were told that now the police can't go into the churches. At least that's what he said to me. Now, I think that it might be a good idea to find out from council what we can do and what we can't do. Doug? So we know before we send somebody down there?
We'll get you an answer. We'll
Would you
get you an
please? Because I read the case, since I'm not a lawyer, which I probably, anyways, it said you couldn't treat the churches differently, but I don't know what that means. And so, but the chief said that he had a police chief's meeting Wednesday. And he was going to call me today, but he didn't. It's okay. He's recovering. I think he's back to work today. Anyways, so he said that's what he told me, and I wasn't going to argue with him because I'm sure his general counsel, they ran it through him. But I think we need to know in writing before we do anything else. If we can't do anything, we can't do anything. We can appeal to their sense of goodness, I guess. But if that's all we can do, that's all we can do. You don't have to agree with it, but we got to stick to it. Sue, any questions about that?
No.
I'll check in with the chief tomorrow.
Okay, Joe, you give me an answer from town council? Please? Okay, because I think it would, if he says we can't do anything, then we can. If he says we can, then we'll do it. Because I still don't know I still don't know what kind of crowd there was there. They were supposed to go that Sunday. I don't know if they went or didn't go. Tammy didn't get a report. So, I mean, that's still let's drop it till we find out from town council if we can do anything. How's that?
Hey, wasn't there a recent outbreak at one of the churches out in Midwest or the West? Anybody?
Well,
hear
there
that
are
in
outbreaks
the
all
news?
over. Yeah. I mean,
Big
anytime
outbreak.
you have a gathering, you get an outbreak.
Yeah, but it was a big outbreak.
Okay. Tammy, anything else?
I'm sure there's always something.
Sure.
Nothing I can think of right now.
Sue,
No, I'm all set.
Jeannie,
Yeah, all set.
Dougie, Joe, Peter?
I'm all set.
Okay, so go ahead.
So I know, so tomorrow, the Department of Public Health, in their interagency, so twice a week, the state has a conference call with all the health departments. Tomorrow morning, they are going to go over more of the planning for the COVID vaccination plans. So we should get a better idea. It doesn't look like they're gonna put anything in writing today or tomorrow, I don't know, but at least they're gonna explain it a little more. So I'll have that information to get back to you guys too. I forgot about that.
Would you be able to send that to us, like a condensed little version, without being a violation of an open meeting law? If an informational email went to the board members? Doug?
Yeah. I'll
Or-
see if they typically do it in a WebEx format, and they publish the slides afterwards. So if they choose to do it in slide form, sometimes the speakers don't, and I don't know if that's for a reason or if it isn't.
You can disseminate any information amongst the board members you want. You
Sure.
just can't discuss it amongst yourselves and reply back with emails that I think we should do this, I think we should do that. But if Carl emails all three of us stuff all the time that's relevant to what we need to know, we just can't discuss it outside of a meeting because you guys are the same kind of quorum. So
My guess is okay. All right, Tammy, so if anything comes up, if
Yep,
you get
I-
anything in writing, just send it to us so we can get some information.
Yeah.
Especially, I sent my board email the other day. I've decided not to run for my next term. I'll be 74 in 21 years. It's time for a new person, somebody else to have a target on their back. So thank you very much. I'll finish out my term, hopefully with some success with this vaccine, and then I'll step aside. So thanks, everybody, and I'll get a motion to adjourn.
Well, first of all, let me say we're going to be very sorry to see you go after all these years of dedication to the town, to the board, all
you.
your intelligence and all your abilities. It's going to be a sad day.
Well, Sue,
I think, wait till the time comes. I think it's a little too early right now to say you're not going to run. Let's wait till February or March or April.
so Jean, Sue, I was prepared for that.
Yeah, so
Yes,
what you told me.
General
you were
Sherman
gonna-
said it the way I'm going to say it.
You told me if I ran, you would
Yeah, I
run
know,
again
well.
the next year.
Shoot me. If
So don't
not,
go back on your word.
if elected, I will not serve. So that's you could quote that, Peter, if you would like.
That'll be the headline.
Okay, I make a motion to adjourn the meeting.
So,
Second,
okay, favor? Yeah, aye,
Aye.
I.
yes.
Okay.
Okay, listen,
Joking.
everybody